Hello and welcome back to the Healthcare Uncomplicated YouTube channel. Today I have another magnificent guest and leader for you. Before I go ahead, make sure you subscribe to the channel. Also acknowledge our channel partners. And today gives me great pleasure to introduce you to Martin Curley. He's the Professor of Innovation at Maynooth University and also a digital health leader. Martin, how are you?
Great, Joe, and it's lovely to get the chance to talk with you today. And thanks for all the work you do in terms of evangelizing digital health and all the business connections you make.
Thank you, Martin, and also thank you for accepting my invite. And also, it's a very small world. We're talking about our connections, our location, and also how we interlink our connections in digital health. And today we have a very exciting topic: digital transformation in healthcare. And the first question that I have for you is: how has digital transformation in healthcare improved patient outcomes and experiences?
Great. Well, we probably need to define what we mean by digital transformation. There's a couple of definitions I like. One is about it is coordinated change at scale enabled by digital in an organization. And that's kind of the central one we use. I lead a master's in digital transformation in Ireland. That's at the core of what we want to do is enabling digital transformation at scale. And digital transformation happens at two levels. Well, lots of levels, but two main levels. One at a societal or industry level, and then at the organization or say the hospital or care provider level. And then there's a really nice definition from Weil from 2019 that talks about radically changing the properties of an entity through the use of information and communications technology. So digital is both the catalyst for change, it is the raw material as well, but then it actually is the construction mechanism when you develop these new solutions. So one of the things you probably know, I talk a lot about stay left, shift left, 10x. And this is what we're suggesting is a new doctrine for transforming healthcare using digital. A lot of healthcare, there's a lot of really bright people in healthcare, but there seems to be this dogma. Eric Topol talks about healthcare being, the industry that's most resistant to change. And in fact, I certainly have witnessed that, and we've seen some great innovations, but very often there's a lot of blood, sweat, and tears to get these involved. So digital transformation is, has to be very focused on adoption. And one of the methodologies I've been involved with, particularly with the European Commission during the EU Open Innovation Strategy Policy Group, is we came up with a methodology called Open Innovation 2.0. And this is a way of delivering a structural change in industry using digital technology. And we use what we call design patterns. So we identified 6 essential design patterns for transforming not just the healthcare industry, but any industry. So you need to have a platform, you need to have an ecosystem, you need to industrialize the innovation process, you need to use agile methods. But then there are 2 patterns which are most crucial. One is designing for adoption. You have to design these solutions for adoption so they're easy to use, users involved that are involved in development, and they have to have big utility. And then, the 6th pattern is around data-driven innovation. And perhaps this is the most powerful one of all. So I believe we probably have 2 phases of innovation. The first wave is really, it's a little bit about the plumbing and the infrastructure and the digital pathways. So that's the first revolution we need to undergo. And then the second revolution is the revolution of data-driven innovation. And people like Professor Colin Doherty, the head of the Trinity Medical School in Ireland, he talks about the learning health system. And this is where we get into the learning health system when we have all the infrastructure in place and we're generating data. And you probably talk about this more than anybody in terms of wearables, the amount of data we'll be generating as an individual is going to be amazing. But the ability to process that and put digital, closed loop digital control systems in place. So just to kind of, cap that all, we talk about stay left, shift left, 10x as a new doctrine. And what we're trying to do is drive cohesion and coherence around designing solutions which first keep people well, or if you happen to have a chronic condition or need rehab, that you can be treated best of all at home. That's stay left. Shift left's about moving patients as quickly as possible from an acute setting to a home setting. Then lastly, 10x, as you well know, digital is very powerful. And what we do, what we see is that we can do 10x faster, 10x cheaper, 10x better, 10x higher capacity when we use digital in health.
Brilliant, Martin. Thank you so much. Also, I'm a big fan of Eric Topol. He's been on the channel actually over a year ago on 100 episode. And of course, healthcare is really a very difficult industry to change. Also, I'm a big fan of the Doctor Will See You Now, where shift in the way we give the power to the patient. But I love your approach about the stay left, shift left, to bring people out of the system, if you like, because the healthcare systems are over stretched, as you all know, in resources and everything. So moving on, what barriers do we need to overcome to fully realize the potential of digital health technologies in transforming healthcare services?
Well, I think there's barriers, and then how do we get over it? And what I'd propose as a solution, Open Innovation 2.0, is a way of introducing revolutionary change in a non-threatening, incremental way. And if you design solutions that are so compelling, they're 10 times faster, 10 times cheaper, 10x better, then you actually get adoption. But you have to do these changes in an incremental way. So at the core of Open Innovation 2.0 is the idea that you use a living lab. So you co-design solutions with doctors and nurses and patients, and you ideate, you iterate, and then you implement, and you do this very fast cycle. But the main barrier I see is the risk aversion. To change. That's a real barrier. And I think Steve Borthwick, the UK Health Secretary, he talked about, actually, we're now at a time where the risk of doing nothing far exceeds the risk of actually trying something. So I think this aversion, and you might, and your listeners might well be aware of the example of Semmelweis, who is known as the savior of mothers, who had some really clear data in the maternity hospital in Vienna showing that, washing hands, dramatically reduced the mortality rate of mothers during childbirth by a factor of 3x. And, his teachings were totally rejected, and it was only maybe 10, 20 years later till Pasteur came up with his germ theory that was understood what he was saying. But ultimately, Semmelweis paid with his life. He was incarcerated for his beliefs in a mental home. He got beaten up by the guards, and he died of sepsis. So we know there's a really strong resistance. And Eric Topol and others talk about it takes 17 years for a medical innovation to get fully adopted across the world. So I think that's the number one barrier, is just this inherent resistance and risk aversion. But the second thing is, and to be fair to medical staff, there's a lot of really busy people, and particularly in A&E and in acute hospitals where you have very sick people, doctors and nurses and physios, they're extremely busy. So it's really hard to get the retention. And I think the way to get around this is this theory of designing for adoption and doing something that is 10 times better, 10 times cheaper, 10 times faster. And as part of Stay Left, Shift Left, 10X, we look at the quadruple aim. I'm starting to call it the quintuple aim now. So what we're looking for is 5 different benefits from a digital solution. And very often we can get these 5 benefits. The first is better outcomes or improved quality of care. The second is lower cost and or better value. The third is improved clinician and patient experience. The fourth is improved patient and clinician quality of life. And the fifth is actually an improvement in sustainability. Not a lot of people know this, but the NHS is the biggest plastics polluter in Europe.
Wow.
And a lot of these solutions, are a lot more sustainable. Telehealth is a really good example. But to give you one example, when I was in the HSE as Director of Digital Transformation during COVID, we adopted a really nice innovation from Trimedica, who are based in Belfast. And that's a thermometer which is 10% more accurate than the current tympanic thermometers, but it has no plastic parts. So every hospital each year is dumping skip loads of plastic caps. But this solution, because it's non-contact and non-infrared, it solves the sustainability issue. But it's also, in terms of accuracy, it's good. It actually reduces 80% of hospital infections are spread by contact. This eliminates contact. It's also 5 times faster for the nurse to actually read a thermometer or temperature using this thermometer. So it's an example of meeting all 5 areas of the quintuple aim. So to kind of summarize, it is difficult. There's risk aversion. People are really busy. But if you can provide a solution that's so demonstrably better, it's easier for the clinicians to use, it's better for the patients, then it will get adopted.
Thank you, Martin, for this amazing insight. And the takeaway is that really big barrier, the resistance to change. And there are of course the other issues that you mentioned that are also important and push things back. Moving on, the last question I have for you is, how can healthcare organizations effectively navigate the cultural and organizational changes required for successful digital transformation?
Well, you've hit on something really important, because I'm a big fan of Peter Drucker. Peter Drucker used to say, culture eats strategy for breakfast. So you can have the best strategy, you can have funding, you've got best solutions, but the culture determines everything. And in my experience, I spent 30 years in a high-tech industry. The culture comes from the leader. And, leaders who actually lead by example, they just don't say, do it this way. That's the way that I do it. They do it. And, I've been blessed to have worked for some amazing leaders and, people like Paul Otellini and Craig Barrett, who were CEOs of Intel, and AJ Banga at MasterCard, and Jack Welch at GE. And they set the culture, and it actually comes from the leader. So one of the tools that I find really useful, I teach a masterclass in digital transformation and on our master's program, is the culture canvas. And this is a really powerful tool where you can actually co-design a culture for the future with your other leaders. And I also recommend including patients and frontline clinicians, where you define, well, what's our vision? What's our values? What's our governance? What's our decision-making process? What behaviors are acceptable and should be rewarded? What behaviors are not acceptable? And if there's one behavior that I think has to be completely extinguished from healthcare, is bullying. I saw a lot of that going on in healthcare. I saw very little of it in the high-tech industry, because professional companies deal with that, and there are exceptions, of course. So I think it's all down to the culture. And culture in the past was a black box, but now with tools like the culture canvas, you can explicitly design your culture for the future. And it's probably, also with leadership, it is the number one predictor for success of a digital transformation or indeed success of any organization.
Brilliant. Martin, truly, truly fascinating interview. I mean, it's so much to explore, and your knowledge is outstanding. And you also have something really special. I want to thank you for your contribution to the industry, but also you have your hands-on experience. You've seen a lot, you experience it, the barriers, the implementation. You worked for quite a long time as a director of digital transformation at the Health and Safety Executive. Sometimes we have one experience, but we don't have the full picture, and you have that. Thank you so much for sharing your amazing insights with us. I have one final item, which is not really a question. It's a bit of it's due to the channel. I'm looking for a short answer, which is how can we make healthcare uncomplicated?
That is great, and simplicity is really important. You know, my personal life motto is dream, dare, do. So dream about a really simple system, and stay left, shift left, 10x is really simple. And using that, you know, is this innovation, is it going to help keep somebody well or allow them to be treated at home? Is it 10x? And by that way, like there's a lot of a fantastic innovation going on, but sometimes it actually interferes with it, you know, and one innovation will cancel out another one. So your message about uncomplication is so important. And I think stay left, shift left, 10x is the mantra to make it, you know, simple, that we're all innovating in the same direction. Then I would say dream the new solution, envisage it, dare to do it, and then just do it. Yes,
Really,
it's simple.
Martin, what a fantastic way to round up. I want to thank you again for your, to leaving this last stamp, which is fantastic. Also, to coming on the show for your amazing contribution. And we're talking before the show that we're probably going to meet very soon. So I'm looking forward to that. Thank you so much for being in here. I'm going to round up now.
Okay, look forward to seeing you in Brighton soon.
Thank you, Martin. To all our viewers and listeners, make sure you subscribe to the channel. Also, to get all this amazing content every week, follow us. And I'm going to post Martin's LinkedIn here and socials. Connect with him. He's got amazing expertise and experience in the industry. And acknowledge our channel partners to finish off. And I'll see you all next week.